One of the projects Transnet is most proud of is a train that we operate. It is a train consisting of 18 coaches, and it visits various railway stations on its 9-month journey in some of the most remote areas of our country. It doesn't pick up any passengers, and it doesn't carry any cargo. But when it stops, and wherever it stops, it holds the power to change lives. The power to bring good, clean health, hope, and new beginnings to communities often in desperate need for the most basic primary care. Since 1994, this train has reached millions of South Africans and spread its message of health to millions more. This train is called the Transnet Phelophepa Healthcare Train, and here is its story.
There is a train that blazes a trail across the heartland of South Africa, heading for the faraway places, the forgotten towns, the dusty sidings that lie beyond the often traveled track. There is a train whose calling is awaited by those who live in need and wait in hope, who rise before the dawn to begin their journey, listening for the whisper of salvation in the distance. Watching for the gleam of light upon the rails. There is a train they call the Wonder Train, the Miracle Train, the train of hope. And wherever it stops, the mission of health and healing begins anew. For this is the Transnet Phelophepa Healthcare Train. The train that puts the promise of a better life on the line. Phelophepa. The word means good, clean health in the Sesotho and Setswana languages of South Africa. And it is a notion given everyday meaning by the lasting success and sustainability of a project that is unique in the world. A mobile health clinic using the reach and infrastructure of the national rail network to bring affordable, accessible primary health care to communities that lie beyond the main line of the state health service. A project of the Transnet Foundation with generous assistance from private sector benefactors. Phelophepa is a model of innovation in the delivery of public services. But this train, with its carriages fashioned from repurposed rolling stock, is powered, in truth, not by the motive forces of miracle and wonder. It is a train powered by uncompromising clinical integrity. Driven by the strictest principles of financial management and control. guided by the highest standards of corporate governance. It is a working train. It is a train that works. And yet, no one who has been touched by the power of the Phelophepa can deny that it carries a touch of miracle in its wake. The miracle of sight for those who have long struggled to see. The miracle of peace of mind for those who have been visited by trauma. The miracle of freedom from pain. The miracle of freedom from fear. The miracle of a way of life that can change lives for the better. The miracle of good, clean health. Since its inception in 1994, the year of South Africa's transition to democracy, the Transnet Phelophepa healthcare train has touched the lives of almost 5 million individuals and spread its message to 17.5 million more. For this is not just a train that comes and goes on its trek from town to town, from station to station. This is a train that leaves a legacy of learning, of self-help and healthfulness, as it reaches out from the platform to communities far beyond. And just as communities learn from the Phelophepa, just as the seeds of knowledge and care take root, so too do those who ride the train learn from those they serve. The Transnet Phelophepa healthcare train carries a permanent crew of 20, along with up to 40 medical students who join the train on its journey for 2 weeks at a time. They earn no money for their 10 to 12 hour service a day. But the experience they gain is priceless. This is more than a train. This is more than a clinic on wheels. This is more than a flagship of corporate social responsibility. This is a vehicle of hope and change. And at its heart lies a force more powerful, more unstoppable, more boundless than any other we know. This is the Phelophepa. This is the train of love.